I'm Jared. I'm 25 years old. I'm a medical student up here in Sacramento, and my dad's Filipino, my mom's Italian, so growing up I really enjoyed eating a lot of loving meals. The things that I like to do for fun when I have the time to do that is hang out with friends. I like to go swimming. It's a little cold for that right now, but hiking, there's a lot of nature up here. And I recently started trying to get into DJing because I really love music. You know, I struggled with my weight a lot growing up. I was told by the doctor I had prediabetes, especially even as a kid. I've been in the Digbi program for about 3 months. I started, I want to say in September, October-ish. And being in the program has been really awesome because I've been able to have feedback from people, and I've also, it's been a way to keep me accountable for the choices that I'm making. I've lost about 15 pounds. I didn't really start the program looking to lose weight. I wanted to really focus on making healthy choices, and this is kind of one of the things that just kind of happened because of that. One of the coolest parts about Digbi is that they have the continuous glucose monitor, and when I was using that, I was able to see how my blood sugar responded to the different types of foods that I ate, and I was able to make informed decisions, you know, even after the glucose monitor ended. I wasn't on any medication before starting the program, but I did have that conversation with my doctor about starting. One of the medications that he had mentioned was metformin. That's a common drug for diabetic patients, kind of like a first-line thing. But I really wanted to try and improve my lifestyle habits before considering something that medications and things like that. Overall, since I've started using Digbi, I've really increased the amount of vegetables that I'm eating, and it's really helped my body and my gut feel much better. Digbi's been a really awesome part of integrating improvements in my physical, mental, and just overall lifestyle choices. I feel like I have more energy to study throughout the day. I'm not waking up feeling groggy or tired or sluggish. Overall has been a big help because I'm just trying to balance the stress, the mental toll, the physical toll that being in graduate school can take on your body. And so I really wanted to make sure I was aligned in my mental health, my physical health, and able to show up as best as I could. Covered from my dad's insurance, and so his insurance package included Digbi as a preventative health benefit, and I've also been working at a student-run community health clinic. Many of our patients don't have insurance, so translating the knowledge that I have now to help them has been really rewarding. I would absolutely recommend Digbi to my family, my friends, and my fellow students as well, because it's an awesome way to learn more about nutrition, especially being in medical school. We're not taught a lot about that, and so you really have to look for outside information to get that nutrition information. And I think I've not only benefited, but my future patients will also benefit from me having that better understanding of nutrition. Yeah, so I would definitely thank my Digbi health coach, Chelsea V. She's awesome. She gives me the feedback that I'm really looking for. They're really making a difference in people's lives, and I think if you are able to find that consistency and feel those benefits from all the program has to offer, then it's really life-changing, not only for you, but for the people around you as well.